How's your day going? Hope you're doing okay. Rifle London, thank you so much for asking. My day has been slightly difficult, but I'm happy to be here. I'm happy to be alive, blessed to have my health, my family, all my loved ones, and this YouTube channel, and to be really close to graduating from dental school. So thank you for asking. I hope that your day is going well as well. Hey friends, welcome to the channel and welcome to this video. My name is Steven and I am a 4th year dental student, and today we're doing a Q&A. I'm almost finished with dental school, but before I leave, I wanted to go through a bunch of your questions from Instagram and YouTube and tell you a little bit more about myself and my journey through dental school. So sit back, relax, grab some popcorn. There are a ton of questions, so I'm gonna try to get through them as quickly as possible. I hope you enjoy this one. All right, we're gonna start in the realm of pre-dental advice. Best way to know if dentistry is something I should pursue. Now, I think the best way to figure out if dentistry is for you is to actually see it with your own eyes. I would go to a dentist, whether that be a general practitioner or a specialist, preferably a general practitioner, and watch it with your own eyes and see if you enjoy it. See if it's something that interests you, that excites you. If you go in there and you watch it and your eyes just get super wide and you're like, man, that's so cool, I want to do that, I would consider pursuing dentistry. I would consider it. If there's something that doesn't really click for you or it doesn't feel fully right, I would maybe do a little bit more searching, but I would consider maybe not going into dentistry. The other thing I would say is if you have a connection to someone in the dental field, if you have a parent who's a dentist or a brother or sister, somebody who has a dental practice that would be willing to offer you a job out of dental school, then I would consider dentistry as well. It's nice to have the opportunity to work somewhere, get a good job right out of dental school, because in this market, it's becoming increasingly difficult for young dentists to find jobs. So those are a couple things I would consider if you're discerning dentistry. Y'all look at this real quick. It's 77% of you aren't subscribed to the channel. What the heck is that? If you like what I'm doing here and you want to see more videos in the future, subscribe to the channel. It's free, it's easy. There's a button down below. Hit the subscribe button, join the crew, and I would appreciate you. It'd make me happy. Do you have any advice for people applying this cycle? I've done a lot of pre-dental advice in the past, so I would say definitely browse my channel to kind of hear some of the things I've talked about. But my advice for dental students outside of the numbers and your grades and the DAT and all that is always to just be authentic and be yourself. I think what happens sometimes is people go into dental school interviews and they go through the admissions process and they try to present a character or a caricature of someone that they're not. And you have to think, like, the amount of impressive people that are applying to dental school every year is insanely high. Rather than trying to artificially impress, be yourself, be authentic, and be honest. Open up in your dental school interviews. Show some emotion and some passion and some honesty. And I think those are the things that are gonna transfer forward, and also show passion for dentistry. I think that's super important. If you had to restart the dental journey, what would you do differently? Honestly, I've been sitting here, I don't know if there's anything that I really would do differently. I think that my dental journey, everything in it has just sort of come at its own pace. That's an important thing that I've had to learn, is things do come at their own pace and things happen when they're meant to happen. So I don't know if I would necessarily go back and change anything that I did. I don't regret not doing something necessarily. I mean, maybe I could have gotten a little bit more experience in a dental office before I started, but the thing about that is when you're a pre-dental student and you haven't gone to dental school yet, walking into a dentist's office and trying to learn things is quite difficult because you don't have any foundation yet on what it's like to be a dentist. You don't understand what the dentist is doing. The main purpose of shadowing is to see if dentistry is for you and to start to learn some basics about the field, but you can't really dive super deep because you don't know the very most simple basics of dentistry and teeth and dental procedures. Does a hygienist have any advantage of getting into dental school? I've been a hygienist for 7 years and currently working on my bachelor's degree in bio, hopefully to go to dental school afterwards. I would say absolutely a hygienist has an advantage when it comes to getting into dental school. In my dental class, we have a few of them that were hygienists before they came to dental school. The numbers are still going to apply. You're still gonna need to get the grades in your prerequisite courses, and you're still gonna need to get the grade on your DAT. However, showing a dental school that you have a passion and a lot of experience in the dental field, that's gonna be massively helpful to you. Now, should you go into hygiene in order to eventually become a dentist? No, I wouldn't waste your time becoming a hygienist and your money just trying to get into dental school. If you want to go to dental school, start applying now. But if you're already a hygienist and you don't feel fully fulfilled and you want more and you want to go into dentistry, then I would say yes, you do in fact have potentially a leg up. Just get those grades and kill it on the DAT. Okay, so moving on to sort of D1 advice, because I got a ton of questions about this. What was the development of your hand skills like? Does it become second nature? So as a D1, you start out, you're working with your hands every day, and it is terrifying and it is scary and you're really bad at it. There was and has been a development of my hand skills. It's been a gradual one. I remember actually a point during my D2 year when I kind of felt like I was really improving and things were actually getting much better for me. But then everything else has just been gradual. You have a handpiece in your hand for so many hours in dental school, but it's nothing compared to what it'll be like when you're out of dental school and you're actually in practice. So your hand skills get better. It's a gradual process. It does kind of become second nature. Like, you know what to expect. You know what things feel like, generally speaking. You know what your goal is, what you're trying to make it look like, and you have all of this experience to kind of back that up. Definitely they improve. It certainly takes time, and some people pick it up earlier than others do, but everyone gets there in the long run. I promise you that. The golden rule an incoming D1 should know. I think the golden rule for D1s is, honestly, don't stress. When you get into dental school, there's so many emotions. There's so much like imposter syndrome that's going on. People are trying to find their place in dental school and in life. You're picking up this new skill and craft that is so drastically different from anything you've done before in the past. You're learning a ton of material every week, every day. I think people get overwhelmed and they stress out about the bigger picture. And so my advice for D1s and for any dental student is to try to like break things down into bite-sized pieces. If you look at the semester as a whole, or the year as a whole, or dental school as a whole, you're gonna get so overwhelmed. And I know people that do this, like it's sort of the OCD types, they're neurotic types. They get really overwhelmed about things, and it's like, if you can just break things down into like literal goldfish bite-sized pieces and just take things one day at a time, you will get there in the long run. Remain faithful, remain vigilant. Just try not to do everything all at once. And don't get stressed and overwhelmed if you get into your first year operative courses and you can't cut a class 2 as well as the person who sits next to you. I was there myself, have been many times, and here I am, a D4 on the verge of graduation. You get there, it is just part of it. Look at me, I'm giving crazy advice today. What's a great way to hit the ground running when I start dental school? Get organized. Organize your freaking binders and your iPad. Organize your textbooks, they're all probably online. Build out an organization system, whether it be through Notion or Evernote or whatever software you're using. And then when it comes to your lab side of things and the dentistry stuff, get organized there as well. Don't be that person that goes into the lab and just has stuff scattered everywhere. Okay, I have been that person a time or two, but try not to be that person because it makes things much more difficult if you're just not organized. How long did it take you to get used to the environment of dental school? So our situation was just so weird because we started dental school in 2020 during COVID. It was just weird for me and for my classmates because we were in COVID times and we were in the very beginning of dental school. Like the first month of our dental school experience, I did back home in Nashville, 3 hours away from my dental school because it was 100% online. So that was super weird. And then once I moved here to Memphis, I remember spending so much time here at this desk in my own little world, studying all of this random stuff, never meeting my teachers. Like a lot of them, I didn't even really know what they looked like because they were a tiny 1-inch box on a Zoom call, not knowing half of my dental school class until literally D2 year. It was just different for us. And I don't think my experiences as a D1 would necessarily reflect what it would be like these days. But I will say, once we did get into dental school, I adjusted pretty quickly. It's similar to undergrad in the sense that it's a lot of new information, it's meeting new people, it's new experiences, and those things at first are always kind of like nerve-wracking and scary, but you just pick things up. You get there eventually, and that's kind of how my experience was. What is grading like in dental school, and do you get a GPA? So grading in dental school is the same as it is in undergrad in terms of like your didactic courses. Things are slightly different. The numbers for an A and a B might be different than they are in undergrad, but that system is exactly the same. In terms of your lab and your clinical stuff, it is all professor graded. So you have different professors in whatever lab it is or in whatever department it is in the clinic, and they will grade your work hands-on. They'll look at your preps, they'll look at your restorations, your dentures, numbers, all that stuff, and they'll give you a grade based on that. And you do get a GPA. A GPA is something that certainly we do at my school. I don't know if there are schools that don't do it. I think the pass-fail schools wouldn't get it. You wouldn't do a GPA. I don't know. I go to a traditional GPA school, so we have one. Mine's kind of low because I don't really care about it that much, but I'm not specializing. Just trying to get out, become a dentist, make a little money, enjoy my life. Gosh, should I have said that? I'm gonna cut that out, I think, maybe. What has been the hardest part of dental school for you? I would say the hardest part of dental school, and this is slightly abstract, feeling like I wanna be out of dental school. And that doesn't mean that I have hated it or that I haven't enjoyed it or anything like that. There's certainly been a lot of parts that I didn't enjoy, but there's been a lot in this past 4 years that I've loved. A lot of times in dental school, I didn't fully buy into what we were being taught, and I complained internally and externally about being in the situation that I was in. And I don't know if that was necessary. It wasn't a good thing. It wasn't like an edifying thing for me to do that. But there were just a lot of moments where I was like, I don't need to learn this. I don't want to learn this. I just want to be out and be in the next step. And you know what's funny about that? I remember being an undergrad thinking the exact same things. Like, I don't want to be here. I don't want to learn this. I want to just get to dental school and learn the stuff that actually matters for me. So what's the advice there? The grass is always greener on the other side. I do think I'm gonna enjoy clinical practice much, much more than I've enjoyed dental school. But there's gonna be things that irk me in practice, just like there's been things that have irked me in dental school. And so I can't sit here and act like once again, everything's gonna be perfect once I graduate from dental school and go into practice, because I know for a fact, based on my life experience, that there's always gonna be stuff that bothers me. So that's been the most difficult part of dental school for me. I know, once again, that's kind of abstract. You're maybe looking for like a specific course or a specific procedure, and there are a ton of individual scenarios that were hard for me. But yeah, that's kind of my thoughts there. How did you navigate dealing with unpleasant/rude classmates, faculty, and patients? This is a wonderful question, because these people exist and you're gonna come across them in every place in life, certainly in dental school. For me, I think I experienced this the most in the beginning of my D3 year when I started in clinic. And at first it really irked me and bothered me. I was like, why are people so just mean and that's like unpleasant? A lot of people don't love their job necessarily, and their job is just something they have to do in their 9 to 5. Like they go, they show up, and they do their work. And so I don't think you can blame people if they're not pleasant all the time. Obviously, if somebody's outright rude, like they shouldn't be doing that, and that's wrong. But I wouldn't necessarily take things personally if you have a patient or like an administrative person at your school that's just not very nice. You don't know what they're going through. They could be going through a lot of things, and the response to that is not to be upset or to be offended or anything like that. It's just to sort of take it on the chin, give them a little grace, and move on. Like, you're trying to get through this experience. It's 4 years. You have an end goal in mind, and that's graduating and getting your degree. So just kind of roll with the punches. All right, studying questions. How can I train my mind to remember everything that I learn in dental school? In my understanding, this is impossible. I don't think that you can learn or retain everything that you've learned in dental school. Do you know how much stuff I learned in the last 4 years? And do you know what percentage of it I have retained up here? There's obviously like not an exact numbers that I can put on that, but it's probably pretty low. The high yield stuff, the stuff that I do every day, the information that I need to have in my head to make good clinical decisions for the good of my patients, that stuff's there. The random things from D1 year, like most of D1 year, it's just not there anymore. Like, you could say it and I would be like, oh yeah, I've learned about that before, but I don't remember the pathway. I don't remember it. And you don't really need to. Unless you have a photographic memory and you can actually remember everything that you see, this is not feasible, and it's also unnecessary. Learn the high yield things as they come so that you can perform well in your exams, get the grades, get the degree. And then when it comes to clinic and learning how to do dentistry, you're gonna start doing them so often that those things become second nature and you won't forget them. Daisy's in the background, chugging her water. Can you lay down? How do you stay consistent in studying in dental school, and what was your schedule like during your D1 year? Consistency for me was all fear-based. I studied the best when I had the exam looming, but whenever there was an exam coming up and I knew I needed to study, I would just sit down and crank out the Anki cards, make sure that I was just getting through the information as much as I could before the exam. And then my schedule as a D1, I talked about this in past videos, and I'll try to find that and leave a link here, so hopefully I can do that for you. One quick finance question. Can you explain how loan repayment works? Just a general idea, please. Thank you. D2 at RSDM. So this is the book that you need to get in order to answer this question, because Dr. Dolly is an expert on finances and I am not at all. This book is awesome. Read it cover to cover. There's a lot of stuff in here for like med students and things, but he does talk specifically to dental students in a variety of scenarios. And a lot of the financial information that he gives to med students also applies to us. So this is the book. Check it out. All right, let's get into some clinic advice. Starting clinic next month, any words of wisdom? I think I've talked a lot about clinic on this channel, so I would direct you to this video specifically because I kind of dove into that whole topic and I gave you kind of some of my thoughts when I was closer to actually starting it. The biggest thing about clinic is, once again, get organized and try to like stay on top of that, because I think one of the most difficult parts of clinic is not the dentistry, it's everything that surrounds clinic. It's scheduling patients, it's filling out all the forms, it's knowing where to find things in the clinic. There's just a lot that goes into it, and I would give the same advice I kind of gave earlier, which is to basically take things as they come and don't look at everything as a whole in terms of your requirements, because like I have this Notion page of requirements for dental school, and this page here was just filled with things that I had to do. All of this stuff here was still to do a few months ago, a lot of it was at least, and now it's all done. So the purpose of me showing you that is to say that you will get through it. You just take things day by day. Oh, and the other thing I always tell students that are going into clinic, schedule a patient in every single opportunity you can in clinic as a D3. I promise you, doing that will make your D4 year much easier and much less stressful. How to balance clinics while studying. Just now entered third year, love from India. Well, hey, shout out to India, love from the United States. I would say balancing clinic and studying is one of the difficult things about clinic. And for me, it was just, I got my work done during the day and at night I came home and studied. But I will say, I don't know if I studied necessarily as much in my third year as I did in like my first 2 years. That doesn't mean it was easier. It was actually probably harder. I just didn't study as much or as consistently. Sometimes I would actually not schedule patients on the days leading up to exams, just to give myself a little bit of breathing room and a little bit of time to study. It's difficult. It's one of the hard things about dental school, honestly. Let's talk about clinical dentistry. Favorite and least favorite procedure. Favorite procedure is something to do with oral surgery. Right now, I love doing oral surgery, and it would probably be a maxillary third molar extraction or potentially like a full quadrant of extractions. I enjoy doing stuff like that. Least favorite procedure, in dental school, it would have been something perio related. So probably like a perio eval. That might be my least favorite thing to do because it's just so freaking boring and there's so much information to input into the computer and it's awful. But I'm not gonna be doing that as a dentist, like perio and scaling and stuff like that. So what would be another option for you? I don't know, a DO and a maxillary molar. It's terrible, I don't like it. It's not that bad actually, but yeah, I guess. Is getting a master's in endodontics financially worth it? If not, what specialty? Do not make a decision on which specialty to go into because of money. Because to me, like that just sounds like a perfect way to make yourself miserable. Your decision to go into a specialty should not be based on money. It should be based on what you enjoy doing in dentistry. And this is another reason why I sometimes kind of shy away when people say things like, oh, I'm a D1 and I know I'm gonna be an oral surgeon someday. Like, there are scenarios when that makes sense and it's real, but I don't think the decision on what to specialize in should be made until really your third year, when you're already in the clinic and you're doing things. Pick the thing that you enjoy. Pick the thing that you want to do for the rest of your life. Because, for example, specializing in endo, if you hate endo, you have no other, like that's what you do every day and you're gonna be miserable. And so certainly don't pick it because of money, pick it because you enjoy it. You know, if you wanna straighten teeth and you wanna work with kids, do ortho. If you wanna do root canals and you're freaking nerdy about them and you're just super into that and you're not the type of person that wants variety, do endo. If you wanna be crazy and a psychopath, do oral surgery. If you like working with kids, work with kids as a pediatric dentist. And if you wanna be like me and you wanna do everything, be a general dentist, it's sick. But yeah, don't pick your specialty based on money. That's an awful idea. Tips on how to perfect class 2 premolar resto. Wedge it tight, burnish the band. Oh, and then one thing I like to do is take a little bit of bonding agent and work that in on top of your packed composite to smooth out the restoration and to kind of shore up those margins, and then take that sucker out of occlusion, or mostly out of occlusion at least. I have some sight issues where my depth perception isn't the greatest. Will this be a limiting factor, or is dentistry more tactile? I don't know the extent of your sight issues, but I would definitely say that dentistry is a very visual field. Like, you have to be able to see to do dentistry. You have to be able to feel as well, but I think it'd be tough to not be able to see super well well and to do dentistry, especially in scenarios like I was talking about earlier, where you're working on posterior teeth in the very back. It's dark, hard to see. There are some situations where you actually can't see and then it's fully tactile, but I think the ability to see is certainly something that's good. So once again, I don't know the extent of your condition, but it's something to consider. First piece of dental equipment you want to buy. Great question. Thank you, Jacob. Good friend of mine. Probably be a scanner. I would say that the scanner is the first thing that I want to buy for my practice. The scanner allows you to do a variety of things. I think that one of the first things that we want to kind of add to the practice is clear aligners, and scanners make that workflow super easy. We can also start scanning crown preps and sending the files straight to lab. My partner in my practice does a lot of dentures, and so he could probably use the scanner for scanning arches to do dentures. We could scan our implants when we get to that. Like, that's definitely the first big piece of tech that I want to buy, because we already have a cone beam in the office, so that's there. Probably just be a scanner and then an implant system, and then potentially a printer as well to do guides and clear aligners. What's the one thing you're looking forward to once you graduate? Not being in school. Like, I'm so excited to be back in my hometown in Nashville with my family, with my girlfriend, and to basically not be in school anymore, not having tests and assignments, doing what I do, enjoying it, building a practice, and going home, loving my girlfriend, my parents, my family, and having a personal life. Like, that's the things that I'm looking forward to. And honestly, being home in Nashville, like I love it there. I prefer it to Memphis, and I'm excited to go home and start my life there. Where's the next adventure in dentistry? Going home to Nashville. I'm going to be practicing as a general practitioner in a small town outside of Nashville called Ashland City, Tennessee. My partner is going to be Dr. Drew Schneider. We're going to build an amazing dental practice. I'm super excited about it, and I just can't wait to get started. And I'm going to continue making YouTube videos to show you the process. So subscribe. Do you plan on making any changes to what's already in place in your private practice? Absolutely. The first thing that we're going to do, my partner and I, who's young like me, he's only 5 or 6 years older than me, we're going to go from traditional paper records over to a digital record system, which is an essential for me. That's the biggest and like first thing that we have to do in the private practice that we're going to be taking over. So we need to go from paper charts and, you know, paper over to computers and iPads and things like that. And it's going to be an absolute doozy of a process, but it's, like I said, super important to me. And that would be the first thing. We're also adding clear aligners, talked about this a second ago. Adding new procedures, implants is the biggest thing that's coming down the line. So there's a lot of things that I want to change, but it's mostly just adding and building rather than like tearing things down. The foundation is absolutely 100% there. It was done by 2 dentists who have worked very hard for many years caring for people. So that's the foundation. We're just going to build on it. So fitness, what's your workout routine / how do you make gains while in school? My workout routine is just like, I try to do something every day. Sometimes that's just as simple as like a walk. You know, I try to get to 10,000 steps. Like, that's like the most basic thing that I do. But then most days I do get in the gym for like 30 minutes. Check out my recent day in the life if you want to see like my actual day routine. And I'll get in the gym and I'll lift weights and I try to push and pull really hard. I do struggle to put on muscle, I think, just because of my body type. So it has been difficult to make gains in dental school. Just lift and eat a lot of protein. And then I do still run, not nearly as much as I used to, but I do love to run. It's something that I don't see myself giving up until my body gives it up for me. That's my sort of fitness routine. All right, into the personal section. How hard is it to do long distance in dental school? And similarly, do you have a girlfriend? Yes, I have a girlfriend. Her name is Rebecca. We've been dating for almost 7 years, which is insane. I love her to death and I miss her. She is back home in Nashville, so we do long distance. It has been very difficult. It's been one of the more difficult aspects of dental school for me, just not having her here. But the way that I've dealt with that is honestly just fully transparent. It's just been to go home a lot. I've spent a lot of weekends in dental school back in Nashville with her because the weekend is the only chance that we would have to see each other. So, you know, we've tried, basically our system was like, don't go longer than 2 weeks without seeing each other. And certainly there have been times when that got stretched out a little bit. But for me and her, it's just been an effort made by both of us to see each other and spend time with each other. And then when we do have the chance to be together in person, we just try to make the most of it, try to see each other as much as possible. It's been difficult, but we've made it work. And that's like one of the best parts about graduating and moving back home is getting to resume my relationship with her. I'm super excited about that. And it's also been nice though, because having somebody in your corner fighting for you and just supporting you through the process is really helpful. And even though it was on FaceTime with her most of the time, it was really good. It was supportive to me and I needed it in many times. So yeah, I love her. She's good. What would you do if you weren't a dentist slash YouTuber? Well, I think honestly, if I wasn't a dentist, I would still be a YouTuber. Like, I really enjoy YouTube and I enjoy creating content. I enjoy video and photos, so I might try to be a videographer or a photographer, but that would be such a hard space to like make it in, and I don't know if I actually would make it in that space. I'm glad that I'm in the field that I'm in. When I was a kid, like my childhood dream was to become an architect because I love drawing. I drew these back here. I love drawing and I loved drawing houses as a child, but I don't know if I would have made it in architecture either. I think God put me in this position for a reason, and I think that I'm exactly where I need to be. So I'm really blessed and I'm really happy. What do you do when you feel that you are down for dentistry? And I think you mean like down about dentistry. This happens a lot. You know, things are rough in dentistry, and I think the best way for me to deal with it is just to compartmentalize things. Like, try to leave dentistry at the office and just don't let it come into your personal life. It certainly will, like it has for me very recently. But the most important thing, like I said, is just to try to like section it off and don't let it affect your personal life. But then I would just say do things that you enjoy. Like for me, like one of the things I enjoy doing most is watching movies and TV with my girlfriend Rebecca. So we'll get on FaceTime together and we'll watch things, and it just like allows me to decompress and not think about anything. Another thing that I do, and I've talked about this a little bit recently as well, is I pray. I'm Catholic, and so I pray the rosary and other prayers, and those help me as well because they just calm me down. They connect me to my Creator, and I feel that the love of that relationship, and that's the best way to honestly get over really anything in life. And so I'm happy that I have that, and that's probably how I manage the difficulties of dentistry. How do you stay focused on personal growth without the constant urge to compare yourself to others, especially when others are doing better than you? Great question. This is gonna be a very Greg Doucette answer, but I don't like to compare myself to others. If I'm gonna compare myself to anything, I compare myself to myself. And that's just a great way to do it, because if you compare yourself to others, you're gonna be absolutely miserable constantly, because there's always people out there, especially in this day and age of social media where people put themselves out there and they show you their best. A lot of times their best isn't actually real. It's just what they're showing you. But one thing, that I always try to do is compare myself to myself. Make sure that I personally am improving. And if I'm not, I need to make changes. But I don't want to compare myself to other people. And I still have so much to do. Like, one thing I really want to do in the coming years is get rid of this thing and start picking up those things more and reading more and just becoming more of a learned person. The Greg Doucette answer: compare yourself to yourself. All right, after all of this, let's see what it's been. Oh my gosh, I've been recording for 40 minutes. This is gonna be miserable to edit. There was a lot of questions, but I wanted to get through as many of them as possible. Thank you all so very much for being a part of this journey with me, watching my videos, supporting the channel, and sticking around. If you're watching the end of this video, you're one of the best people out there, and I really appreciate you. Make sure you subscribe, like the video, leave a comment. If you have further questions, I'm always down to answer them. I am so close to the end of dental school. I can taste it. It is just right there. And I'm gonna be doing a lot of reflecting in the next couple of months on this experience, because what a time it has been. Thank you guys all so much for watching. And as I always say at the end of my videos, I will see you in the next one.